Hello, my name is Leila Nishatian, and thank you for the opportunity to present our manuscript titled Rectal Prolapse, Age-Related Differences in Clinical Presentation and What Bothers Women Most. Rectal prolapse is a debilitating condition that can affect patients of all ages. It has a diverse clinical presentation, and validated symptom assessment tools have been used to quantify the severity of symptoms such as fecal incontinence and constipation and assess improvements following surgical repair. Although these tools have been useful in measuring the functional outcome, they do not account for patients' prioritization of their symptoms in seeking medical care. We aim to identify bothersome symptoms and clinical presentation that motivated rectal prolapse patients to seek care and characterize differences in symptom severity with age. We studied 129 consecutive women with full-thickness rectal prolapse from a prospectively maintained registry of patients with rectal prolapse. Patients were divided into younger and older groups based on their age cutoff at 65. We found that after fecal incontinence, pain related to rectal prolapse was commonly reported as a bothersome symptom and was significantly more common among older women with full-thickness rectal prolapse. Age older than 65, prolapse expression at rest, and use of narcotics were independent factors associated with bother from pain in women with full-thickness rectal prolapse. We showed that despite similar Cleveland Clinic fecal incontinence scores among the groups, significant fecal incontinence with a CCFI more than 9 was more common among older patients. And conversely, obstructive symptoms of high severity based on obstructive defecation syndrome scores were significantly more common among younger women. To our knowledge, this is the first study investigating the effect of age on clinical presentation and degree of bother related to rectal prolapse. It is conceivable that age-related differences in rectal prolapse clinical presentation can be attributed to the differences in underlying pathology. We suggest that when considering surgical repair, preoperative common symptom scores should be evaluated in the context of patients' perceived bothersome symptoms. Although the severity tool that we used didn't quantify the degree of bother for each individual symptom, this should be considered for future surgical outcome measures, and we should focus on measuring surgical success by adding the perceived variable of bother to the validated score in the future studies. Thank you.